In September 1978, representatives of 134 countries, 67 international organizations, and many non-governmental organizations got together for the first international conference on primary health care. The meeting in Alma Ata, Kazakhstan, was convened by the World Health Organization and the United Nations Children's Fund to discuss what seemed a worthy but unachievable goal: health for all by the year 2000.
Salud para todos es fundamentalmente.
Health for all is basically a social goal, but even more a political goal, because health for all is a response of the world's countries to the great inequalities in health status among different peoples.
Situación de salud de los pueblos.
I think that everybody got to Alma Ata with a clear idea of what they wanted to achieve. They were sharing great concerns for the disparities, for the unacceptable inequalities between the rich and the poor.
By the 1970s, a number of developing countries had been experimenting with new ways to tackle health problems with limited resources. That was the basis for what became known as primary health care, a way to see health as much more than simply treating disease.
Salud es ver las condiciones.
Health means healthy living conditions, preventing specific risks, and preventing specific diseases, and curing and rehabilitating people, but doing all this in an integral way.
Sino todo en una forma integrada.
The concept of health for all was a social call to action.
People had a lot of enthusiasm. They were building on the experiences of hundreds and thousands of communities and village and health workers and political leaders. They wanted really to push for a new economic order that would be fairer, that would be based on social justice.
Health for all to me means that everyone has access and all the rights that go along with providing humanitarian assistance to everyone, regardless of race, ethnic background, and socioeconomic background.
Not all goals were achieved, to be sure, but many achievements followed Alma Ata.
It was an aspiration of the peoples of the world, and in that sense, from my standpoint, it was successful.
I don't think it's fair to say that Alma Ata failed. I think it's fair to say, however, that there were higher expectations that were not realized. Nevertheless, there have been advances, but it is time to recommit. Indeed, I believe the world has recommitted. It's recommitted through the Millennium Declaration and the Millennium Development Goals, a number of which are anchored in basic health, reducing child mortality, improving maternal health, access to clean water.
Whatever progress there was, though, was clearly not enough.
Hoy día,
Today, the injustices are even greater. So the justifications for adopting an integral approach to health for all are even stronger now than 26 years ago.
26 años.
I think the way forward when it comes to healthcare is to understand that there is a right to basic health. There's a children's right, there's a human right, that everyone deserves basic health care.
After 25 years, at least for this region of the Americas, the disparities have grown wider. And that's the reality that we face today.
The time has come to rescue the lessons from Alma Ata with an eye toward the future.
The reach of technology is so vast, and technology is getting so cheap, that I think that putting technology or using technology for improving access and improving care is going to change the world in a revolutionary way.
The Pan American Health Organization is ready to act and work with all countries to finally make health for all a reality.
So PAHO has been following and supporting the countries to keep that vision alive.
Yo creo que hoy día tendría que ir.
I think it's time for a new collective agreement among all the countries, calling for integral care for all. And there's something very important that should be added, and that is by all. Because the responsibility and duties of healthcare do not belong only to the state or to certain institutions, but to everyone. In families, in schools, in the workplace, everywhere.